qualified to speak to us tonight on this very important topic. Now, as was done last week, you can type your questions either in the YouTube chat or in the Zoom chat, and Dr. Beckles is willing to answer questions during the presentation as well as the end of the presentation. So once you have typed the questions in the chat, I will acknowledge it and I will let him know and he will answer your questions. So without further ado, Dr. Beckles, the screen is now yours.
Thank you very much for that. Again, very, very gracious introduction. Good to be here on this Sabbath. Thank you for the 7 Days Adventists and all the sponsors. This is goes in line with my mission for a much healthy lifestyle, and so I very humble accept this meeting tonight. Excellent, and please do ask questions. Can you all see my slide?
Not yet.
Just getting the slides load up here, share screen.
We can see them now.
Okay, excellent. Very good. So good evening, everyone. The agenda today will be on what is exactly, when we say someone has kidney disease, what does that mean? And how common is it? And you want to ask the question, are you at risk for it? Am I at risk for chronic kidney disease? And how do you go about diagnosing it? How can I reverse it? Is it possible? And what is the treatment if you do have kidney disease? And we'll go over in a summary and some questions, but I want to leave this open forum for anyone to chime in the chat and ask questions. And Kishelle, please stop me if there are any questions. So for most practical purposes, there are two types of kidney disease that you'll be hearing about. One is called acute kidney injury, and acute means something that's sudden in onset, something like infection, something that is causing obstruction. And that's a medical emergency. And then the most common type, which is the most of this talk, is going to be chronic kidney disease, which is an ongoing, as you can see here in the bottom of this slide, progression where you start with normal. And yes, these are your kidneys. They look like kidney beans. And that's why kidney beans are called kidney beans. There's a reason. You can go from normal and you can progress as you have risk factors, and we'll go over all those risk factors. And then at some point, the kidney gets some sort of damage done. Here is where you could go and reverse kidney injuries by taking care of the risk factors. Once you start getting a decline in function, reduced kidney function, one can progress over years and years to what's known as kidney failure. And that's when patients are on dialysis. And hopefully we can try and avoid getting to that stage. For the essence of completion, these are the different nomenclature used throughout the talk. So AKI in the first column, it just basically explains the duration. How do one define chronic kidney disease compared to acute kidney injury? Acute injury, kidney injury is defined as anything less than 7 days. As you can see, as one progresses, CKD is if your disease state is more than 3 months. That's when it's officially defined as you have chronic kidney disease. And so this is just a different nomenclature. And what we see over time is that there's a progression. What starts off as acute kidney injury, stage 1 to 3, one can have recovery if you take care of the infection, obstruction, etc. And there could be late recovery, but like I said, this is acute. One have to go to the hospital, one have to go and see the emergency room or doctors. Otherwise, it can lead to death if things happen too fast. Chronic stage kidney disease, which leads to dialysis, is something that goes on progression over time. So just to show you two different entities. Now, let's break up the kidney system into what we call pre, intra kidney, and post. In the pre, what it means is when you have acute kidney injury, it's caused by things that are what we call before or proximal to the kidney itself, and things like blood loss, hemorrhaging, dehydration, even heart failure and sepsis. These things, and even vascular occlusion. One can have atherosclerosis within the arterial vessels that can close off eventually over time. And just like one can have a stroke and you can have coronary artery disease, you can have disease anywhere in your artery system. Even those can affect the kidney. And that's defined as a pre-renal entity. Intrinsic renal dysfunction are things that are toxic to the kidney: drugs, toxins, prolonged low blood pressure. Some infections can cause that, autoimmune. So this is just to break it down into the whole different possibilities. And what that means is you have to seek medical attention. That's what this is saying. You cannot diagnose this on your own. You have to go to your doctor and find out what's going on with your kidney. And then you can see post-renal, which is also common when you have strictures, anything that blocks the urine from getting to the bladder or block urine from coming out of your bladder. Anything like some cancers, even benign prostatic hypertrophy, when your prostate is really swollen. You can have metastatic disease. You can even have kidney stones. So all these things can present as renal failure. And in this case, it's acute. I want you to look in the right lower hand corner. The causes for kidney failure in the United States, and this hasn't changed over decades, the most common cause of renal failure, diabetes. And I know you had your diabetes talk prior to mine. We talked about high blood pressure last week. So these are the two most common causes for why someone is on dialysis. If you go on the dialysis unit, people that are on hemodialysis, or you know friends that are on dialysis, you ask them, why are you on dialysis? If you look back at their history, they have uncontrolled high blood pressure, uncontrolled diabetes. Many years, it accumulates and destroys the kidney over time, and then there's no way of reversing that. Just for anatomical completeness, the kidneys are located towards your back posteriorly and in the middle of your abdomen. And so just to show anatomical completeness here, the two kidneys are seen there attached to the blood vessels. If we were to take a kidney and zoom in and look at the unit of a kidney, it's called the nephron. The nephron, so each kidney comprises approximately 1 million nephrons, each of them. And it's basically blood comes into the kidney, as you can see in red, blood comes into the kidney, gets filtered, go through a whole process of different gradients, osmolarity gradients, in order to come up with urine in the end that then collects into your ureter and goes to your bladder. So that's basically in a nutshell what the kidney does. Maybe that's a bit too much, and I'm sorry. How common is chronic kidney disease? So this is really the meat of the topic. So looking, these are facts from 2017. In the United States, 15% of US adults are estimated to have chronic kidney disease. So that's about 1 in 7. If you look around the room, 7 people, 1 in 7 would have chronic kidney disease. But this is most important. 48% of those with severely reduced kidney function, but not on dialysis, are not even aware of having kidney disease. Because again, just like hypertension, it's a silent killer. It creeps up on you until one day I will go over all the symptoms. 96% of people with kidney damage or mildly reduced kidney function, and we'll talk about the stages, are not even aware that they even have the disease. So this is what it looks like in a breakdown. Stage 1 to 5, kidney disease. A lot of patients would have stage 1 and not even know about it unless they go and get their blood work checked. An even better demographic is shown here. So most patients combine stage 1, 2, and 3 don't even know they have disease of their kidneys. Okay, only when they go and get checked and they get their lab work done, they say, wow, do you know you have kidney disease? And that's when it's first found. Stage 4 and 5 is when patients are on dialysis. As you can see, it's the minimal. It does lead to a higher mortality, decreases your survival. The goal is to stay out of 4 and 5 range. You can see that as we go through, this is all-cause mortality, and you can see the each year. This is a chronic kidney disease surveillance system that exists, and it's highly monitored here for all the patients that are in different paying groups. But the gist of this chart is just showing that the worse the kidney function, and so here you see GFR is less than 15. The worse your kidney function over time is the higher your mortality. So it used to be as high as 25%. And you can see that it's definitely the worse your kidney is, the worse your outcome. So the goal here is to prevent this from happening to you ever in life. When we talk about cardiovascular disease, well, cardiovascular mortality, these patients, remember, the same risk factors that cause your kidney to fail and cause your heart to fail and cause you to get a stroke, diabetes and hypertension, again, it's also your risk factor for heart disease when you have diabetes or heart failure is increased up to 6-fold. So we'll go over all of the diagnosis, but what's used is in your urine sample, when you go to the physician to ask about your wellness exam, this is one of the things we're going to stress on towards the end of this talk. You will ask for a urine analysis because you want to know if you have albumin in your urine. And so once you have albumin in your urine, it's actually leaking and it's abnormal. So one should always have normal amount, but when you get to a higher amount of albumin in your urine, it is portend to worse prognosis and even cardiovascular disease. Now, I had to look up some data because I live here in America. I'm always keeping an eye on Trinidad. So here's some Trinidad data, and this is actually looking at 2009, one decade to 2019, very recent data. What causes the most deaths in Trinidad and Tobago? Well, according to this latest profile, it was a worldwide study. The 10 top causes, you could see here, heart disease is number 1. But look at diabetes and stroke is number 2. And number 4 is what we're talking about, chronic kidney disease. Of course, you can put this in any amount of order depending on what risk factors you have. If you have hypertension and diabetes, then you should be looking out for these top 4 as causes for mortality and decreasing your survival. This is the global burden of 369 diseases that was studied in 204 countries, including Trinidad and Tobago. When they asked the question, what causes more death and disability combined? When you combine, some people think disability is worse than dying. So when you combine both being disabled, not able to function at work, taking you away from loved ones, taking you away from being a productive person in society, disability and death, look at diabetes is the number 1. Ischemic heart disease, again, coronary artery disease, number 2. Stroke is number 3, but number 4 is, again, it's in the top 4. Chronic kidney disease is why your community is emphasizing all of these topics to prevent you from being in these top 4 areas and trying to improve your overall health. If you can stay out of those top 4, that will be excellent. That's the purpose of these talks. So what risk factors drive most deaths and disability? If you look at the number 1 risk factor, what's your risk factor? It means what risk do you have? So if I check your fasting glucose and it's high, ding, 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 that's the number 1 cause of why your survival will be decreased. So you have to check your glucose more often to make sure that even if you're diabetic, you keep it under control. A high glucose in your blood circulating in your entire blood system is not good. And unless you check it, you will not know what it is. Second is high body mass index, and of course, blood pressure, all of the talks, and dietary risk, needless to say. So am I at risk for chronic kidney disease? That's the question. So again, to emphasize, if you have diabetes, if you have high blood pressure, if you have diabetes and you have high blood pressure and they're both well controlled, A1C is normal, your blood pressure is in the normal range according to what has been discussed in this platform and in the series, and I'm sure next year we'll also have the same series to emphasize this. If you control your diabetes and you control your blood pressure, you should have a normal life expectancy as someone who does not have diabetes and high blood pressure. So the goal is to really take care of your numbers, know what your A1C is, know what your blood pressure is doing. Again, having a family member with kidney disease puts you at risk for having it. Being of different ethnical background can also cause you. And of course, as we get older with age, the risk factors do add up, almost compound effect over time. And so I showed you graphs of hypertension happening in young individuals as early as 20 years old. So it's very important to get screened, know your numbers, know what your ABCs are. So what are the symptoms? But clearly, we talk about not having too many symptoms at all. But if your kidney is starting to fail because of the buildup of all the toxins in your body, because your kidney is responsible for getting rid of all the buildup of waste in your body, what we call nitrogenous waste, you do start to have some itching, scratching. One can get muscle cramps, nausea, vomiting, not feeling hungry, swelling in your feet is very prominent, and ankles. If you're not making a lot of urine, clearly, as you eat more and more food and as you intake and it's not coming out, you can see how one can get into trouble. The system is not balanced. If your kidney stops working, that means you stop making urine altogether. That's an emergency. Again, your abdomen, your belly will swell up. You get a lot of back pains, diarrhea, fever, even nosebleeds. You're pretty sick. All right. Rash and vomiting is the least of it. So how is it diagnosed? Again, it's always better to find out in a preventative way how your body is doing before finding out when it's a disaster. Same thing as having, if one is driving, for instance, a car, you want to know how much gas is in the tank. So you want to know your numbers. Is it full? Is it empty? So you want to know what your numbers are. You don't want to wait until you run out of gas and it's a disaster. Because in this case, and just like hypertension, if you don't know you have high blood pressure, you don't know you have diabetes, if you never get checked out, it's like flying an airplane. And then one day you have no gauge and then all of a sudden you just fall from the sky. It's pretty bad. So how is it diagnosed? So there are many tests that can be done, but the two simplest, I would say three simplest ones, clearly, even if you're going in to check for kidney disease, you want to make sure your blood pressure is normal. And your doctor will do what's called blood work, called Comprehensive Metabolic Panel, CMP, to measure your creatinine. Your creatinine is a compound that your body excretes to tell what exactly is your kidney function. So it's a direct estimate. There's a formula one can calculate to determine what's called the GFR, the glomerular filtration rate. GFR, you will see throughout this entire talk. And you see in the right-hand corner, if your GFR, your glomerular filtration rate is more than 60, it means you're totally normal. All right. If you're under 60, somewhere between 50 and 60, you have severe kidney disease. And once you get to less than 15, that's where you get into that transplant mode. You get into that dialysis mode. It means the kidney is not reversible, never come back. Okay. So this is the sort of staging system that's used by hospitals and doctors and internationally when we're talking about what stage kidney disease. So if I'm calling here from the States and I'm calling in Trinidad to find out, hey, what stage kidney disease do you have? This is what you will be talking about. And this is what I'll be, finding out from your doctors. Okay, you're in stage 1 or you're in stage 2 or you're in stage 3. And that tells me exactly what's going on with you as an international standard. So we're not talking about different diseases. You can see here that albumin, depending on how much albumin or protein is spilling out in your urine, will determine how severe your kidney disease is. And again, depending on your GFR, what is your creatinine level, plugged into that formula will tell us what stage kidney disease exists at that moment. These are other tests and very sophisticated tests depending on what you're looking for. And so it's, I just put it here for inclusion to be complete. A number of tests will be done once diagnosed with kidney failure, and mostly to find out if it's a reversible cause. There's some things you can reverse, things like infections, things like high level of proteins, things like stenosis. These things can be treated and reversed if it's picked up early. And so they may even want to do what's called a kidney biopsy to take a look at the kidney under the microscope to see exactly what's going on. So depending on how much fluid and how fast kidney disease occur, what happens is that will determine what your symptoms are. If one accumulates fluid too fast, you have a difficulty breathing. You'll find that your exercise tolerance is decreased. One can go into heart failure. One become very drowsy as the toxins accumulate. You want to sleep all the time. You get what's called encephalopathy, dementia, strokes. All systems are affected when your kidney is not working well. And again, that's because the kidney have a lot of roles in the body to keep things normal and balanced and homeostatic. Kidney is involved in making blood. Excuse me. So in making blood, it actually helps for oxygen, for tissue oxygenation, because blood has to be carried throughout your body. It also helps in acid base, and that's why one will get shorter breath. It's involved in fluid management, and so patients may have strokes and heart failure. And so bone density is also part of the function of the kidney to maintain vitamin D levels as absorption in the gut and for metabolism. So the kidney is a very important organ, just like all organs are in your body. And so one have to try real hard to really maintain and keep the kidney working well. Again, for being complete, one can start with normal kidneys, what we're born with. And with these risk factors, you can see the arrow showing reversibility. You can have increased risk factors, but hopefully with a lot of education, a lot of encouragement, getting to know your numbers, you can decrease those risk factors dramatically and hopefully reverse the kidney injury if it's early back to the normal stage. Once there is damage done over years and years of ignoring it, that becomes more troublesome, but only when you start decreasing your rate due to prolonged damage, that's when you get kidney failure. And so it's a progressive from normal to not doing well. So how can I reverse kidney disease? So again, to emphasize, this is a health, lifestyle, talk, webinar series. And again, if you have diabetes or high blood pressure, working with your doctor, working with your community to get it under control helps to prevent kidney disease. The two top causes, hypertension and diabetes, you have to go get checked out to know and treat these things. Living a healthy lifestyle, of course, it's all part of overall fitness to also decrease salt in your diet, decrease fat in your diet. So eating well, what you eat is what you are. A little bit of exercise, 30 minutes minimum, have regular checkups with your doctor, don't smoke, and limit your alcohol intake. This is a recent article, 2020, looking at a well-studied diet, plant-based diet, and what it does in patients with chronic kidney disease. You can see here, which make a lot of sense, and this has been advocated more and more, is increase fiber in your diet, decrease lipids, and decrease protein are perfect for someone who have chronic kidney disease. It decreases your blood pressure, decreases inflammation in the body, decreases your chance of getting cardiovascular disease and also mortality. So overall, this moving to a plant-based diet has been shown over and over. There is a choosemyplate.gov. The government has instituted recommendations for those who have chronic kidney disease, and this is made specific for those with chronic kidney disease to eat a certain amount of protein, vegetables, fruits, dairy, and have a balance, and of course, cut the salt. This is just recommendations. So again, to emphasize, control your blood sugar, knowing what your blood sugar is, keeping it in the normal range, having a healthy blood pressure, again, in the normal range, follow a low salt, low fat diet, exercise, healthy weight, tobacco, all the things we know that one must change their habits is exactly what one has to do. Just to give you an example, patients come into me all the time and say, oh, my A1C is 8, and they're happy about that. Well, if you look at the scale, 5.6 is normal on your A1C scale. When you get to 5.8 and above, that's called pre-diabetes. Only when you get to above 6.6, 6.6 and above, that's defined as full-blown diabetes. So when somebody comes to me and say, I am 8, and think that's a good thing, just to show you here, every 1 point decrease in your A1C, that means going from 8 back to 7 or 6, every 1 point, look at the massive amount of reduction in any complication. 21% decreased rate of dying, 37% decreased rate of having blindness or kidney disease, like what we're talking about, kidney disease, 14% decrease in having a heart attack, 43% decrease by one factor on your A1C of having an amputation of your toes or feet, and 12% decrease in having a stroke. So 8 is not acceptable by any means. So I encourage you to put this on your refrigerator, take a picture of it, use that as a guide, get your A1C down to normal as possible. Because what these numbers are showing you is that if you have a A1C in the 6.5 range, it means that you're running around with a glucose on the higher side. If your glucose is always running around averaging 200 all day long, 24 hours a day, 7 days a week, every day, 365 days of the year, that's going to lead into decreased survival and all of the risk factors we just talked about: kidney disease, heart disease, peripheral vascular disease. So having a high glucose is not good. Emphasis. Okay, what is the treatment for chronic kidney disease? So everything I mentioned above, controlling all your glucose levels. So first step is getting screened. You can't treat something if you don't know you have it, because you really have no symptoms. Unless you go and check your blood pressure, you really don't know what your blood pressure is. So you have to get checked out. You have to go to either screening program. There are a lot of health fairs around. Churches are very much in support of that. Even your local pharmacy may have free blood pressure checks. You have to get screened. You have to ask for it. You have to ask your doctor. If your doctor says your blood pressure is fine, we don't need to check anything else, you have to insist. You have to be an advocate for your health. Ask for a urine test. You want to know if you have protein or albumin in your urine. Your doctor will be surprised that you know more than him. Ask for it. It's all part of a healthy workup. And you can see here, you're getting screened if you have risk factors. So who should be screened? Anyone with a family history of kidney disease, anyone with acute kidney injury, what we talked about, if you have diabetes as a diagnosis, or you have hypertension as a diagnosis, if you have underlying cardiovascular disease that you already know of, if your age is above 60 for sure, and of course, if you're pushing on a little bit too much weight, or what we call obesity. So these are the people that should get screening from your doctor. And so we talk about the blood test, look at your GFR or your creatinine level, just to ask for a comprehensive blood test. Starting with those two things, that will then calculate your GFR to know where you are. If you're normal, if you're above 60, or if you're in the danger zone. You need to know that, so then you can make lifestyle changes to prevent some of the problems down the road and prevent. One can slow the progression of chronic kidney disease if you fix the risk factors. Again, this is the whole progression. Green means there's chance to reverse, meaning a plant dominant, low protein diet, physical activity, smoking cessation, weight reduction. These are all things you can do proactively to prevent going into renal failure. If you're already into that disease progression, they may have to look more closely, and there are medications to give. And of course, this is trying to prevent you from going all the way to the purple, which is dialysis and transplantation. And that is to be avoided at all costs. So what is hemodialysis? There are hemodialysis centers set up all over the world, and it's for the treatment. It's for treatment with patients who have end-stage kidney disease. That means they're not making urine, or some of them are actually making urine still, but the kidney is not functioning well to do its job to get rid of the toxins from the body and to decrease creatinine and the uremic syndrome, the itching, the scratching, the mental status changes, feeling of confusion, heart failure, and leg swelling. So going on dialysis, what it does is it removes anywhere from 2 to 4 liters of fluid 3 times a week, and that's what your body would have made on a normal basis if one is eating normally. What happens is there's a fistula, or some people may have a catheter. Blood is taken out from your body and cycled through a machine where it gets filtered and cleaned up, and blood is returned to you within the same site. And that happens for about 2 or 3 hours, 3 times a week, in order to clean up your blood, in order to have a much better quality of life. There are other types of dialysis called peritoneal dialysis. Physicians do surgery, place a catheter in your abdomen, really in your abdominal, what we call peritoneal space. Fluid is infiltrated and fluid is taken out. And so basically it's the same sort of system to get rid of the toxins from your body, with a lot of fluid going in and a lot of fluid coming out. And so those are the 2 options for dialysis that's most commonly heard about. Of course, kidney transplant is a rare commodity. That's what your kidney looks like. Implantation of a kidney, it can come from someone who has passed away, or people can donate their kidneys. God has made us with a lot of redundancy. I can take out someone's entire lung and you still won't even recognize that they have 1 lung. I can donate my kidney to you, and my kidney function will still remain normal. So by the time someone gets kidney failure, it means that you have more than 50% of your kidney not working, for sure. So one can donate their kidney after getting enrolled into a good transplant program, and it's surgery, but it's trading one disease for another disease, because you have to stay on immunosuppression therapy for the rest of your life. So I made some analogies here, just thinking about why would people not go and get checked out? So if you have a simple car, you go and get oil level check, you check the hoses, the belts, pressure gauge, air in your tire, your battery, your brake system, for goodness sake. If that's not working, imagine driving down the road and then you have no brakes. So those are disasters if any one of these things does not work. And the human body is the same way. You have to know what your blood pressure is doing. You have to know what your glucose level is doing. You have to know what your cholesterol is doing. So ABCs, A1C, blood pressure, cholesterol, D is for diet, and E is for exercise. A, B, C, D, E. Couldn't get simpler than that. Well, if you're comparing a car to a human, shiny paint job on the outside, looking at your skincare, how aerodynamic the car is, tells you how healthy you are. The dashboard, the meters, the brakes, battery, it's like the brain. Gas and oil is the food we eat, and the tires are like your feet. You put this into, some sort of, analogy. You have to get checked out because we do it for other things, and you can't compare the human body to anything else on planet Earth. It's very precious, and you have to take care of it. You don't take care of it, it's not going to last, unfortunately. So same thing with pets. Pets, people walk their dogs. That a lot of pet owners, their pets are more healthier than them. Their pets can run around the entire park 3 times, but the pet owner could barely even sometimes, go up 1 flight of stairs. So again, look at how we treat pets. We treat pets better than we treat ourselves. Okay, so again, pets get 30 minutes of walk every day. This is like a checklist if you want to be a responsible pet owner. Okay, pet food, people go through a lot of trouble just pick the best food in the world for their pets to get and eat. All right, so we have to do the same thing for ourselves. Clearly, if we can do it for our pets, we have to do it for ourselves. And even sleeping, they make sure their pets get enough sleep every single day. And so we stay up all night and miss, really abuse sleeping habits. So again, habits become really, is what we are. So we really want to check up on those bad habits and switch them to good habits. Now, this was recently done looking at pet owners actually healthier. So I encourage you to get a pet. Having a pet is actually one of the most healthy things. Fewer visits to the doctor. So because you have to go and walk your dog for 30 minutes, you as a pet owner actually have to exercise during that time. And that's the minimum amount of exercise for any animal, even human beings. So get active, really start moving around. People that have pets have decreased, obesity because they have to stay active. They have to keep up with their pets. So again, another, analogy. Here are 2 similar cars. One that's not taken care of. Nobody know how much, if the brakes is working, if the oil was changed, clearly the paint job, nobody took care of it compared to someone who actually took care of their body. So again, your choices over time, good habits, eat well, exercise, sleep well, know your numbers, ABC. I can't emphasize that enough. And again, what you put in your body is what you become. Very simple. So to summarize, most kidney diseases are actually preventable. It's your choice. Most common cause, diabetes and high blood pressure. Get checked out today. Schedule for your tune-up. Okay, you tune up your car, you take pets to the vet. You have to take care of yourself. Only you can love yourself more than anybody else. Don't expect anybody else to love you more than you. Protect your body from bad food. Make good choices today. Connect with health-minded folks. Like all of you on this call, this is what it's all about. Health-minded folks. Seek and you will find. This is it. You're seeking and hopefully you get the information you're looking for. Health, happiness, and know your numbers. A, B, C, D, E. Can't emphasize that enough. Thank you very much. And if you have any questions, please let me know.
All right. Thank you very much, Dr. Beckles, for your comprehensive presentation. While everyone's gathering their questions, Janima. Okay, Janima, let's start with you. Janima has her hand raised. You can go ahead, Janima.
Unmute.
How are you?
Janima, you're very soft.
Hi, good afternoon. Hear me and better?
Yes.
Yeah.
Good evening. Thank you so much for that presentation. My question, this is Janima. My question now, I have an uncle who suffers, he has a few challenges, health challenges. And his foot is now swelling and my aunt is concerned his kidney. However, when they do the kidney function test, it always comes back normal. My question to you, is there any way that you can get a false reading from that, even though symptoms may point to kidney?
So again, right.
Normal.
Right. So there are different reasons why someone would have leg, right? And so if his kidney function is normal, now what is normal? You're telling me his normal creatinine, his GFR is normal? Janima?
Right. That is the that's what I got. I didn't ask exactly what was normal, and probably next time I'll ask that question. So but what I was saying was that they said, well, his kidney is fine according to the test. That's what the doctors would say.
Okay, so then there are other causes for why someone would have leg swelling, right? And so what's his heart function? Does he have heart failure? So again, doing lab work, knowing all his numbers for his laboratory work, the same laboratory work will look at his liver, his kidney. There are certain labs for his heart to see what his function is. And so he needs a full workup, and I'm happy that he's going to the doctor to get those answers. If you have a lot of protein being lost in the kidney, and that's why I told you, you need to ask your doctor to do a urine analysis and find out, is he losing any protein? I'm going to show you, if I can go back to some slides here, is he losing albumin in his kidney? And I'll show you this slide here, if it can come up. Can you see the slide?
Yes, I can.
So you can see here that some patients can lose up to 2,000 of protein in their urine. And so for patients with nephrotic syndrome, if you're not checking albumin levels in the urine analysis and you're just doing the blood work on the left side, you can see how you can miss it. See what I'm saying? So that's why I said you have to insist. So the next time you go to the doctor's office, insist in a urine analysis to look at how much, if protein is being spilled by his kidneys, and if the kidney function on the creatinine is normal, then we can eliminate kidney as a source of the problem. And that's good news. Then we still have to find out why his legs are swelling up. Okay?
Okay. Thank you so much.
You're welcome.
All right. So Dr. Beckles, can prolonged use of any drugs like prescription drugs or any drugs, painkillers or anything, could that affect the function of your kidneys over time?
Yes, there are a lot of drugs that we call nephrotoxic. So they're toxic to the kidney. Your pharmacist knows all of them. They all come with a label. All the medications, before it gets approved to be used by pharmacy, they have to go through a huge battery of testing to see which organ is affected by those drugs. So there are specific ones. And so depending on what medications you are, your pharmacist will be able to tell you, is this a nephrotoxic drug, yes or no? The answer is no, then it's fine. If it's yes, so it comes with a label on the inside. All those fine print in every medication package, it says in there, but your pharmacist is much more convenient to ask your pharmacist if you're on a prescription medication, if it has any kidney toxicity.
Okay. And can kidney stones put you at risk for having kidney disease?
Yes, more. Again, it can start off as an acute phenomenon, meaning pain, some hematuria, you have some bleeding as the kidney stone passes. Again, you have to see a urologist in that aspect to make sure that there's no permanent damage to your kidney, to get all the stones out. If the stones, I'm going to go backwards here in my slides. Hold on a second. If the stones cause obstruction, an obstruction phenomenon, I'm going to go back to the anatomy, and that's a very good question. You can see here, right? So right here, in this obstruction where it says urine flow, if the stone is stuck anywhere flowing out of the urethra, you can have fluid that's backed up and swells up the kidney, something called hydronephrosis. And so if the kidney starts swelling up, yes, you can go into renal failure because of kidney stones. You want to make sure you pass the stones or if you have enough space for the stone, for the urine to pass around the stone, always have to follow up to make sure the kidney is not swelling up over time. So they do what's called an ultrasound to make sure that the fluid is not backing up around the stone.
Okay. Is there any major kidney damage in relation to COVID-19?
So yes, actually, we see quite a bit of patients presenting with very severe COVID entity where they get admitted to the hospital, and we do see some components of renal failure. Now, remember, most of the patients presenting with very severe COVID disease right now are those with risk factors, meaning they have high blood pressure, they have diabetes, they have uncontrolled diabetes, so they do have underlying kidney dysfunction to start with. They find out when they get admitted to the hospital and in critical condition, and they find out that they have kidney disease, most likely that may have been ongoing over years and years and years. As I showed you, many people have kidney disease and don't know about it unless you go get checked out. So because this is bringing more and more patients to the doctor's office for COVID, what's showing up on these exams is kidney dysfunction. And it's multifactorial, massive inflammation, massive amount of thrombosis, meaning clotting, slowing of blood going through the system. So COVID is a very, very bad pandemic and causes multi-organ failure, not just kidneys.
Okay. And I heard you said that protein increases inflammation in the body. That's correct?
So going back to the diet, I'm going to go back to my diet slide in prevention. And so looking at this study as a means of reversing, you can see here that the amount of protein, this paper is, I think I included it in the references. When you look at different types of proteins, plant-based protein versus animal proteins, plant-based proteins have less inflammation. And so it's also easier to catabolize. So you can see here, not only decreased protein in terms of the amount in plants compared to animal food, but yes, uremic toxicity, decreased inflammation, decreased formation of things like ammonia in your blood, it basically overall decreases things like phosphorus, which for chronic kidney patients, you have to keep phosphorus very low. So yes, overall, the type of protein, plant protein, much better than animal protein when it comes to chronic kidney disease. Yes.
Okay. So even in a person that doesn't have kidney disease, they should still kind of veer more on the plant protein rather than the animal protein.
Well, again, that takes me back to my plate. One should always have a balanced diet, and one have to really watch what they eat, because what you eat is really what you become at the end of the day. So this is, you want to put quarter of your plate fruits, quarter of your plate vegetables, and notice the largest portion is vegetables. Protein should be a small amount. The smallest amount should be protein, and grains should also be on that high quartile, not 50% of your plate rice and 50% meat. Okay, so the old, potatoes and then steak across, that's not good. All right, we have to start being responsible and accept responsibility for these choices we make and follow this. This is just something that can go on your refrigerator door to remind everyone how the portions do add up over time, and one have to be have a balanced diet.
Okay. Can diet reduce albumin levels?
Can diet reduce what? I'm sorry?
Albumin, I hope I'm pronouncing correct.
Albumin levels.
Albumin levels, yes.
Absolutely. But, what happens in kidney disease is that there is a leakage of protein outside your kidney. And so when I showed the unit of a kidney over here, back to my beginning right here, this is where blood comes in and filtered. So the blood comes in unfiltered, and then it goes through this network, almost like a mesh. This is called the glomerulus. And in this filtration of network, the filtered blood excretes. And this is where the excretion of protein leaves the blood. Protein should not leave your blood. Protein needs to stay in your blood for nourishment. And it's very abnormal to have high number of protein leaving your blood and coming out in your urine. So kidney disease itself is what causes you to lose the albumin more than what protein you eat.
Okay, all right. And I know you're talking about dialysis. Is it that when someone reaches that stage where they have to be on dialysis, can that be a way of life for them, or eventually dialysis stops working and you have to get a kidney?
No, so many people live on dialysis all their life. And it's like everything else, it's having a good control of the risk factors. So if you have two different people, one is on dialysis, but they're not controlling their diabetes, they're not controlling their high blood pressure, they don't want to change their diet, and they think that the dialysis is just a fix to keep them alive, they would progress because of other organs will continue to dysfunction because of the risk factors we talked about. If you have someone else who realize that they're on dialysis and realize that their kidney is damaged severely, but decides to continue to monitor their risk factors, lose some weight, eat well, decrease the salt in their diet, don't eat KFC every day, you know, this type of person changes their risk factors because they change their habits. This person can live quite with the technology in dialysis today, and with close follow-up of laboratory work, one can live a quite decent quality of life and improve survival.
Okay. Next question. When you were talking about giving your kidney a training, you mentioned something about when you get, and correct me if I'm wrong, but when you get the new kidney, you could you mentioned something about immune suppression therapy. What is that exactly?
So getting a transplant means that you're getting someone else's organ. The human body is made in such a way that it will try to reject, and your immune system will turn against the other organ. And so it's a chronic, over time, fight against something else, almost like having similar mechanism as having an infection. Your body fights an infection. Well, having a foreign body, which is somebody else's organ inside of yours, is a continuous immune upregulation. And so one have to take medications to suppress the immune system chronically for the rest of their life if they want to maintain that organ inside of them. So, you know, there are risk and benefit ratios one have to discuss in detail when thinking about transplantation. There are not enough organs going around to transplant everyone who have, you know, chronic kidney disease. The shortage and the bottleneck is in the number of donors that exists out there.
Okay. Will protein powder help to reduce high blood pressure?
What type of protein powder?
It did not specify.
Again, you know, protein, if one were to just eat protein all day, that's very unhealthy. You have to have a balanced diet. Your body needs a balanced diet, not just protein, all food groups. So you have to eat your veggies, your fruits, starch, some protein, has to be balanced.
So for those who want to be on like a keto diet where there's very, very, very minimal carbs, you're saying that may not be the best thing. Again,
so what I usually say is, you know, everyone is different. We're all made up differently. I have a nephew. If he eats one peanut, he can die. I have someone else, another nephew. He could eat a bucket of peanuts and he'll be fine. So we're all created differently, and our metabolism is different. And we really have to get to know yourself. If you go on a keto diet and your body can maintain itself and what you're eating in the keto diet and your metabolism rate, then that's fine, as long as you follow your health and make sure you're not losing out on other nutrients. Some people, if they go on a keto diet, they get dizzy, they have, they feel more weak, they don't have energy. So everyone is different, and it's not uncommon to try different diets. More and more, there are different ways of finding out depending on your your profile. Your profile can tell you if you're ecto, endo, what type of metabolism you're carrying around at this age. You can go through a whole screening and a profile, and it can show you that, okay, you need to drink more water, or you don't need to drink as much water as another person, and you need to focus more on veggies and less meat. So they're a way of profiling people depending on what their metabolism is. So one does not fit all. You just can't feed everybody peanuts and expect, okay, that's it, you'll all be healthy, right? Or everybody go keto, that's it, that's the answer. No, you have to find out, know yourself. You got to find out what works for you. Some people eat meat and they feel horrible. Some people eat no meat and they're like, wow, this is great. I feel awesome today. I'm going to stay off this meat stuff.
Okay, understood. Is there anyone on the chat who would like to unmute their mic and ask a question? Going once. Janima, go ahead.
Dr. Beckles, now I heard you repeatedly say about if it's reversed, can this be reversed? And diet change. Now, is there a way of no return? Because I usually think that when you reach dialysis, then you're there for the rest of your life. Is that true? Or is once your diet is changed, can the body repair itself?
Absolutely. That's what we're talking about here. It's a progression of disease. Once you get into the damaged stage, once the kidney is damaged, you can, and you realize that it's damaged. If you find out when it's already in failure. So for instance, as another analogy, if you have a car and you have an engine and you find out, okay, the engine is just totally gone. It won't even start again. That's it, it's done, right? Compared to if you found out with regular checkups that, oh, the gasket had a leak, or there was an oil leak, or there was something that could have been fixed and repaired and reversed. That's where you intervene and say, okay, we can fix it and now we're fine. If it's left unrecognized, untreated, and when you find it, it's like, it's done, it's dead. The kidney is failed. And that's the stage of kidney failure when you're on a dialysis machine. You get to a point of no return. So yes, you can reverse kidney disease if in this slide, you get increased risk and you go to kidney damage. Even renal kidney reduced function, you could stay in reduced kidney function for the rest of your life if you reverse your risk factors and prevent you from going on dialysis. So we see a lot of people holding steady for 10, 20 years by losing massive amount of weight, dieting, exercising, getting the blood pressure under control, getting the diabetes, they stop smoking. They literally stop doing 5, 6 different things, and that has held their kidney right where it was supposed to be in the first place. But once you get to a point of no return, which is dialysis, unfortunately, that cannot be reversed. I've reversed a few, but that's rare instance. Trust me, it takes a lot of hard work, but it's very, very rare to reverse dialysis. I have taken people off dialysis.
All right. Thank you very much.
He asked what kind of protein powder it is. Synaptogen high protein food supplement.
Okay, so I know that very well. We all took that when we were training in college and playing football and running around. Synaptogen, that's a good powder. So again, it's a balanced powder, have all the essential amino acids that you need, but that's just protein, and that should just go into your protein part of your dish. That does not give you the minerals and the stuff you need, for instance, that you would get in fruits and vegetables, and have a balanced diet. So yes, you can. Now, would that reduce high blood pressure? I don't think so. If that's the case, that would be easy. None of us have to take any medications in life. We could just take, protein powder. So the answer is no. The answer is no. Protein powder is not the cure for high blood pressure.
Okay, thank you.
You're welcome.
Okay, does anybody else have any other question before we wrap up?
I love the questions. Excellent group tonight. Enjoy your Sabbath and feel free to get in touch.
Excuse, one more question. What causes your blood pressure to fluctuate?
So remember that your blood pressure goes up and down during the entire day. It's not constant. So it's just like it fluctuates when you wake up in the morning, depending on a lot of factors, your stress level, what you ate the night before, how much salt you're going to eat for breakfast. All these things determine what your blood pressure is going to be throughout the entire day. So fluctuates. Now, when you say fluctuates, how much does it fluctuate? So if you get angry and your blood pressure shoots up, again, it's an appropriate emotional response. If you see a tiger walk into your bedroom, I'm sure everybody's blood pressure is going to go up, right? So it really depends on the situation. The goal is to keep your blood pressure as within a normal range. If your blood pressure is anywhere from 110 to 120, that's normal. What sort of fluctuations are you looking at?
It fluctuates, like sometimes one, like in the morning time I'll check it and it might read like 120 over 80, and in the night now, if I don't take no medication, it goes to 190 something over 99.
Right. So that's a very good point, and that's a very good emphasis I want to emphasize here. Even my dad does this all the time, and I have to, tell him and educate him all the time. Not because your blood pressure is normal, it means you stop the medications. The reason why your blood pressure is normal is because you're on the medication in the first place. You're not allowed to change your medication or stop taking your medication without your doctor knowing about it. If you're not feeling well with your medication, you have to let your doctor know about it also, so they can change the dosage for you. So that's very common. If you stop taking your medications and your blood pressure goes up, that's what your blood pressure medication is supposed to do in the first place, is help you to keep your blood pressure under control.
Well, I told them about it and they gave me something else. And like that one, to me, like it didn't work in. So I taken night Philippine and I went back on the night Philippine. But sometimes, pardon?
No, so very good. These are all things that I want you to be an advocate for your health. You really have to talk to your doctor. Make sure you get across what is happening. But also, I would go with your blood pressure cuff to the doctor's office. Make sure you're using your blood pressure cuff correctly. I'm assuming you are. But some people, you'll be surprised, they vary the way they actually check their blood pressure. That's number one. You want to check and make sure your blood pressure cuff is correlating with your doctor's blood pressure cuff. So you can check your blood pressure in the car or outside or in the office or in the waiting area, and then go into your doctor's and check the blood pressure cuff then and see if it's actually measuring up to be the same. Almost like calibrating your cuff, because there are different cuffs out there on the market. That's number one. Number two is there are so many different medications to use for blood pressure control. Nifedipine is one of them, yes. And again, it's really about managing the dosage and taking it on time when it's prescribed. You think you're taking a lot of salt in your diet?
Sometimes.
Yeah, so that's the first step. Preventative is trying to change your diet is more important than changing your medication. Okay?
Yes, I try to avoid the salt, but sometimes I just use the salt.
I understand. I have no salt. There are other substitutes for salt. There are things called no salt. There are things like, there are things out there on the market today that you can get without any salt. It's a lot of spices like celery and all that stuff without chemicals, no glutamate, all natural. And you need to look into that until you wean yourself off the salt. Salt, one of the poisons.
You mean you could use like the thing what you just called, what you said? You could use that instead of salt?
You can use it instead of salt. Yes, there are a lot of things on the shelf. Go to your grocery store. There are things called no salt. They're all
okay.
Market full of items that are natural, no artificial flavors. It's really just things like pepper and celery, and something that you can get with your local church to find out what your other friends are using, and get a good health cookbook on how to eat flavorful foods and how to cook your foods, which is also part of all this lifestyle industry, which is awesome and great. But yes,
Okay.
encourage you, decrease the salt.
Thank you.
So we had one more question in the chat. This person has been recently diagnosed with kidney problems, and they said that their doctor said that some more blood work has to be done. No diet sheet, no advice. Doesn't know what stage they are at, and wanted to know if they can contact you for some advice.
Yes, absolutely. Again, get with your local church, get with your local 7 Days Adventist, you know, be with like-minded people who are pro-health, who would like to see a healthy community. And really, these are really simple things to do, but it really comes down to really, really being an advocate for your health. You have to ask your physician for things. Most of these things you can find online. How to eat healthy when you have chronic kidney disease, and start changing some of your, you know, diet as you get back all these blood tests.
All right. Well, folks, that is it for this evening. The one thing that stood out to me throughout not just this presentation, but the diabetes presentation that we had in November with Elder Desmond Croker, is that the choice starts with us. It's our choice. While there are some factors such as our demographics, such as probably certain health conditions that we have, such as polycystic ovarian syndrome, or some other thing that would prevent us or would allow us to be insulin resistant and whatnot. The choice is ours in terms of diet, because hypertension, diet, diabetes, diet, kidney disease, diet, and lack of exercise. So the combination of it, when you have one, it's like a chain reaction if you don't get it under control. If you don't control the diabetes, you could eventually develop hypertension. If you don't control the hypertension, you could eventually develop kidney disease. So we need to make better choices so that we can have healthier bodies and a better quality of life. So this brings us to the end of this series. And Dr. Beckles, we want to thank you very much for your time, for your patience with us, for answering all our questions. I see that you put your email in the chat for the person who needed it. Thank you very much for that. And I will definitely call you again.
Anytime, anytime. Happy holidays, everyone. Enjoy your Sabbath.
Yes, so let's just pray to close. All heads bowed, all eyes closed. Dear Jesus, thank you for this session that we had this evening. I pray that you give us the power over appetite, dear God, and I pray that we would make better choices so that we can have better bodies to do your work, so that we can be healthy and be with you when you come again. This be our prayer in Jesus' name. Amen.
Amen.
All right. Enjoy your evening. Pleasant Sabbath, everyone. Thanks again, Dr. Beckles.
You're welcome. Stay in touch.
Yes, I will.
Take care.